Hello, everyone. Welcome to our webinar to help you prepare for this year's National Adoption Month initiative with the theme Youth Voices, Why Family Matters. This is Alicia Grow with AdoptUSKids, and we're excited to have you join us today. This webinar is being held collaboratively with Child Welfare Information Gateway and AdoptUSKids on behalf of the Children's Bureau. Before we get into all of the details for our webinar, I want to go over just a little bit of housekeeping. This webinar is going to be recorded, so we'll have the recording available for you and for your colleagues if they're not able to join us today. We do want to interact with you, although we have your phone lines muted. We have some opportunities to engage with you. We'll have a couple of poll questions throughout the webinar, and we encourage you to submit questions through the questions pod on your screen at any point during the webinar. We'll have time for questions throughout this session for our individual speakers and presenters. So we'll be able to address questions that you have as we go. We'll also have time at the end for additional questions and answers. And we will be sending an evaluation survey link out by email shortly after the webinar ends. We really hope that you will complete that evaluation survey and give us feedback on how this event was for you so we can use it as part of our ongoing improvement and evaluation of our own efforts. So now let's just go over the agenda briefly so you have a sense of what we're going to cover, and then we'll get right into all of the good content. First, we'll do a brief welcome and overview. Then you'll get to hear some really valuable insights from a Children's Bureau grantee that can help you think about your permanency efforts and ways to work effectively with youth. Then we'll have the key part of this webinar, which is our panel discussion, sharing insights from young adults with lived experience. We'll highlight some great resources and tools that are available to help you for National Adoption Month this year. And as I mentioned a moment ago, we'll have time at the end for additional questions and answers. So with that, I'd like to hand this over to June Dorn. June?
Thank you, Alicia. Good afternoon and welcome from the Children's Bureau to everyone to our 2019 National Adoption Month webinar titled Youth Voices, Why Families Matter. I want to thank everyone for joining us, taking the time out of your day to be with us this afternoon, and I hope you will find this to be a meaningful time. As in recent years, we are focusing attention again this year on the importance of permanency for older youth, for whom aging out of foster care without permanent family connections could become a serious reality. We focus today on the importance of hearing the youth voice as we seek to engage them in explaining the importance of family as they transition to adulthood. I do hope you will find today's webinar informative and useful for your own National Adoption Month planning. And now I would like to turn this back to Alicia.
Great. Thanks, June. Thanks for setting the stage for us for today. So now we have a poll question that we'd like all of our webinar participants to respond to, just so we can get a better sense of who we have here and what you're doing in the field. So if you can respond to this question on your screen, that would be great. We're asking, does your agency have specific approaches that you use to engage youth in their own permanency planning? So your response options here are yes for use with all youth, yes, but only for some youth, no, and I don't know. So we'll give you a moment to respond here, and then we'll show the results. All right, we've got the majority of you have responded. We'll give it just a few more seconds to get these responses in, and then we'll show this. So here we can see that more than half of you have specific approaches you use for engaging youth, using that with all youth. So that's great to hear. And the other 22% of you have these approaches that you use just with some youth. So that may be prescribed based on age of the youth or length of time in care, other factors like that. 10% say no, and 14% say I don't know. So this is all helpful to know just as we go forward with this webinar. We hope this will give you some ideas to build on if you're already using some of these approaches, and some ideas that you may want to explore using if your agency or your organization doesn't have these approaches in place yet. So now I get to hand this over to our next speaker, Dawn Wilson. Dawn, let me get your slide up on the screen, and then you can get started telling us about some of these helpful findings from your pilot work.
Great. Thank you, Alicia. I hope you all can hear me okay. So I want to share just a little bit of what we've learned about the pilot that we did relating to the National Adoption Competency Mental Health Training that was developed for child welfare professionals and child welfare supervisors. And for those of you who don't know, this particular training initiative was funded by the Children's Bureau through a cooperative agreement with the Center for Adoption Support and Education. And we're really excited about the findings, because I think that they really show us some of the work that we can be doing to really help support professionals who are working in the field with children, youth, and families. So you can go to the next slide. All right. Oh, go back one. Sorry. Okay, here we go. So a little bit about this training. So this training is web-based training. It is a 20-hour training for child welfare staff, and 23 to 25 hours, it's maybe closer to 25 now, for supervisors. And again, this is all web-based training, and it is really designed to help professionals to better understand and address the complex and unique challenges that children, youth, and their families in foster care, adoption, and guardianship experience. And it's divided into 8 modules. And we're going to talk in just a minute about some of the competencies that we addressed. But the idea really for this training was that it focused on assessment, preparation, and casework practice with children, youth, and families, again, in foster care, moving to adoption and guardianship, and those already in their adoptive and guardianship families. It includes, for supervisors, a downloadable supervisor coaching and activity guide. And so we wanted to have this additional support to help supervisors to support their staff to apply what they were learning from the training in their daily practice. And one of the things we learned from our pilot sites is that this training really is appropriate for public and private child welfare professionals across the continuum. So while our focus really was on sort of foster care and adoption initially, what we learned from our pilot sites is that what they learned, the actual content in the training is relevant for folks on the front end all the way to the back end, so from child protection all the way to post-adoption supports. So in our pilot, we piloted this training in 8 states and with the Cherokee Nation, and you can see on the map the states that we included, and also the Cherokee Nation based in Oklahoma. We had over 6,000 child welfare professionals and supervisors enrolled, and you can see the breakdown, a little over 4,600 staff and 1,500 supervisors. And there was a mix of what we considered mandated versus voluntary participants. And so while we did not mandate, there were many of our sites that decided that they wanted to mandate either certain positions or units within their system to participate in the pilot. And what we were very excited about is that we had almost 73% of all of those who enrolled in the training complete the training. And so while we're saying it's 20 hours for staff, really it was longer than that, because folks had to fill out surveys to help us sort of understand feedback around the content. Next slide. And this gives you an idea of the professional competencies that we addressed in this curriculum. So we had a module that focused on understanding children's mental health challenges, and that was sort of very broad, sort of understanding the whole scope of problems that might exist and the challenges that exist for children and families. We had a module focused on healing from loss and grief, and really understanding how loss issues are different for this population than from just the general population. We've all experienced loss and grief, but how that's different for foster care, adoption, and guardianship. The impact of trauma on brain development and behavior, and then helping folks understand what that means then in terms of how you parent children who've experienced trauma. We talked a lot about rebuilding and strengthening attachment, and what are the things that professionals can do to support parents and children and youth to strengthen their attachments. Supporting positive identity formation, so this idea that identity is much more complicated for children and youth, particularly adolescents who've experienced foster care, adoption, and guardianship, and what can you do to help support that positive identity formation. Understanding the impact of race, culture, diversity on adoption and guardianship families, and in particular particular, we wanted folks to really understand the challenges related to transracial, transcultural adoption, and what supports need to be put in place to really help support those families in particular. And then equally important, this idea that, you know, adoption is not a one-time event, it is a lifelong process, and so we need to be able to provide supports to families at whatever point in time that they may need those supports. So this idea of post-adoption supports beyond finalization. And the one thing I want to say about our curriculum, when we learned from our pilot sites, is that while the focus was on adoption, mental health competency, folks in our pilot sites really felt that this was very permanency focused. It was really about what can we do to help support professionals in the field to better understand the needs of children, youth, and families so that they could prepare them adequately for permanency, to be stable and have well-being in their families long term. So a little bit about who our participants were. No surprise here, the majority were female, but what I really think is important is that the majority of folks who participated in this pilot were not necessarily what we would consider new workers. In other words, just in the field 1 or 2 years. Our average was 7 years working in child welfare and 5 specifically in adoption or guardianship, and more than that for supervisors. And so when you see the results in a few minutes, I think you need to keep that in mind that we're not talking about necessarily just new staff. You can go to the next slide. So this is a little busy, but I'm going to try to break it down for you. The light and dark green relate to the pre and post test results for child welfare staff, and the light and dark blue are the pre and the post test results for supervisors. And the light color, green and blue, are the pre-test, and the dark are the post-test. And we can see in the middle here we have module 5 circled. And so what this tells you is the average pre-test score and post-test score for each of our modules, which relate to the competencies I just talked about. And one of the things that was very surprising, I think, to a lot of our pilot sites was that the lowest scoring module on our pre-test was around the impact of loss and grief. And I think this really required our sites to do a lot of really thinking about what this meant in terms of implications for practice. The good news is you can see the post-test score went up from 48.4 to 95.1 for staff and 51.8 to 94.1 for supervisors on that particular module. So clearly there was a lot of learning going on from the training. But again, there were a lot of concerns about deficits in knowledge and skill on the front end. So we'll talk a little bit more about that on the next slide. So if we talk about implications for practice, what does it mean if you don't understand the impact of loss and grief? And these are just 2 unsolicited comments we received from participants in the training. The first says, I think the lessons on grieving and culture race had the greatest impact on me. Those lessons helped me to see how grief can be misdiagnosed and how culture can be overlooked, causing serious identity issues. And then the second, we should explain to the children the reasons they left their parents' home. I really did not know that this should be told. By completing the training, I understand the reasons behind that now. And what I want us to really think about is that if we're not having really honest conversations with young people about why they're not able to live with their birth family and, you know, what happened to them early on and what is it that's going on now, what is the plan for them, if we're not really open and honest and upfront about all of that, then we're preventing them from being able to do the healing work that's necessary for them to be ready for permanence. And so I think this was a really significant learning from our child welfare, our pilot in particular. Next slide. So a little bit just about what completers, how they felt about the impact of NTI. And if you can look at the last 2, these were the responses on the percentage of people who agreed strongly or agreed in general that you can use this in your current job and that they would recommend it to others. And then at the end of the training, we already had more than half of all of the people who took the training were already applying what they learned in practice. So clearly this was content that folks who took the training really saw as being relevant to their jobs, and they were actually using it in practice, which was really exciting for us. Next slide. And then when we looked at a follow-up study, what were the areas of impact on child welfare practice? These were the 4 areas that had the most sort of significant kinds of change. Issues around recruitment, training, and selection of foster and adoptive parents, improved assessments and referrals for children, youth, and families, more honest communication and understanding with youth and with caregivers or parents, and improved confidence and self-efficacy. And just really quickly, I want to kind of just give you some idea of some of the comments we heard from people on the next slide. And I'm not going to read all these to you, but just in general around recruitment, training, and selection, I'm excited to bring this new knowledge to foster parents and training and to mold their frame of thinking about foster care and permanency outcomes and challenges. So again, helping folks think about how they can use this information to better educate foster and adoptive parents so that they have more realistic expectations on the front end. Next slide. Improved assessment. So this idea that folks now have an understanding of the kinds of referral modalities and treatment that they might want to make referrals to. So I've made 3 referrals for families to evidence-based practice model since starting this training. And then the other one gives some specific examples: trauma-focused cognitive behavioral therapy and eye movement desensitization reprocessing, which is a particular clinical model. Next slide. More honest communication and understanding with you. So the main ways I've applied this training into my work is helping parents reframe their children's behaviors, discussing the importance of openness when safe, and the negative side effects of keeping secrets. And then this whole idea of now understanding how children and youth yearn for some bonding with their birth parents. And so it's not realistic to expect them to just break off, all contact and communication and feeling and thought about their birth family. So how do we help them navigate that now as they're attaching to new families? Next one. And what I'm really excited about is that this training really helped to improve worker confidence and this feeling of self-efficacy that they can do better work with families. So I spoke with a parent today, and because of the training, I had confidence to give her an educational resource, or I feel less overwhelmed and much more confident. Again, we know when workers have the skills that they need, they can do better work, and then families can have perhaps better outcomes, and that's what we're certainly all working toward. Next slide. So in a nutshell, NTI provides skills, strategies, and tools to support children to heal from trauma and loss, to provide parents with the skills to parent more effectively. And if all those things can happen, we're looking to improve child and family well-being and to increase family stability. Next slide. I think that's the last one. Yeah. So one of our pilot sites made this quote, which I thought was really special. Imagine with our new workers taking NTI along with their foundation training. Think what our workforce will look like in 5 years. So a lot of excitement from our pilot sites about the use of NTI training. And we're hoping that we can sort of spread this NTI training access across all states, tribes, and territories so that everybody has access to the training and then can, have the skills and knowledge and competencies that they need to really do the kind of work that children and families need to be successful. And I think that was my last slide.
Yes. Dawn, thank you so much for that. I think it's such great insights and learning that you're able to share with the field about the use of NTI through these pilots, in addition to the great information that NTI has itself. We do have a question that came in, and it came in earlier as you were speaking, so I think you addressed it maybe in part, but I want to see if there's anything else you'd add.
Sure.
We had a question about asking whether you looked at the impact on the outcomes for children and families rather than just on the completion rate for the training. I know you addressed some of the beyond the completion rate, but do we have any outcome or more detail on what happened with children and families?
I wish we did. That's a wonderful question, and we would have loved to have looked at outcomes, but because it took 4 of the 5 years to develop and pilot the training, we didn't really have the ability within the scope of this particular initiative to do the kind of evaluation that would require looking at family outcomes. We're really hoping that we can get some states interested in the future and really looking at not just using NTI, but perhaps working with us so that we can do an evaluation and really look at outcomes for children and families, and maybe even look at staff retention and other kinds of impacts that this training could have. But unfortunately, it wasn't part of the initial 5-year cooperative agreement. So would love to see it happen.
Sure, thank you. Mm-hmm. And then another question, what's next for NTI, and is this available as a resource for other child welfare systems?
Great, wonderful question. So we're in the process right now of preparing to launch NTI nationally. We're working to make it available on the CapLearn Online Training Center, which is the Children's Bureau funded online training center. But we're also wanting to work with state systems or tribal systems that are interested in integrating NTI into their own learning management systems. or if they don't have learning management systems, really having conversations with them about how they can implement NTI in a way that's really meaningful in their systems. We do have implementation specialists as part of our team that can help do that, have those conversations with state systems. So I would suggest anybody interested in bringing NTI to your system, to your communities, to please reach out and contact me, and we would love to have those conversations. And we're already doing it with a number of states, but we want this to be as broad and as broadly and widely available as possible.
Great, thank you. We had one more question come in for you asking, is this program evidence-based?
So that's a good question. So it is evidence-based to the degree, let me answer this a couple ways. So the content that we used to build the curriculum is based on competencies identified by national advisors, about 28 advisors who are experts in the field, people with lived experience. And those competencies were vetted by quite a number of our whole group of advisors. And then the content was built, as I said, based on the foundation of those competencies, which are based on what we understand from literature, from research in the field. And then in terms of, is it evidence-based now? Well, we have done our evaluation. We do know what the impact is, at least initially, but we haven't done, studies with comparison groups, double blind studies, none of those kinds of things. So that would all be something that we could do down the road, hopefully once we have some maybe additional funding later to do, more in-depth evaluations. But the only evaluations we have right now really tell us what the impact initially is from the training and the follow-up, and that's all. So it's evidence-based content, and we're looking to build evidence now that we've developed it. So hopefully in due time.
Great. Thank you again, Dawn, for sharing all of that. I think that's really exciting to hear about. We had one more question come in, so let's see if we can get this for you. The question is, what is your interface with Family First reform?
Okay, so that's a great question. So one of the things that we feel strongly about is the Family First Services Prevention Act talks about the need for a skilled and competent workforce, and we believe that NTI training is not just trauma-informed, it is more than trauma-informed. It actually takes what we've already know about trauma and helps folks understand how to use that information in their practice every day. So I think this training helps to accommodate or accomplish the goal of having a skilled, competent workforce. And then I think the other thing is, while this NTI training is not specifically on the clearinghouse for Families First, it is the training that will provide your staff with the foundation that they need, regardless of what evidence-based practices they are being trained in. This training provides the foundation for really understanding the needs of children, youth, and families, and how to meet those needs, regardless of what evidence-based practices you might be using. So I hope that makes sense to people.
Thank you.
Mm-hmm.
All right. So if people on the webinar have additional questions for Dawn, feel free to submit those during the webinar, and we can see if we can get to those again at the final question and answer period on this webinar, or we can follow up with you afterwards. I know we could talk quite a long time. There's so much good information about NTI, and it's exciting to hear about. So I'm glad to see this interest from those of you on this webinar, and it's great to get this insight, Dawn, that you shared. So thank you again. Next, we're going to get to hear from Erin Bader from Child Welfare Information Gateway. So Erin, I'm going to hand this over to you to introduce yourself and share some more insights that we've heard from young people.
Okay, thank you, Alicia. Okay, I'm just trying to get my screen straight. So my name is Erin Bader, and I am the Adoption Program Manager at Child Welfare Information Gateway. So I work in partnership with the Children's Bureau and AdoptUSKids to coordinate National Adoption Month every year with a specific focus on the National Adoption Month website, which we will be talking about a little later. So I wanted to say it's interesting to hear Dawn talk about the kind of the lessons learned through NTI, and some of those key concepts you'll notice are addressed in these tips, insights from young adults that I'm going to go through. So in preparation for our National Adoption Month initiative this year, as you can see, our theme and our focus is centered on older youth, and specifically on the engagement of older youth. So we decided that we wanted to develop a publication, a tip sheet for professionals that was youth driven. And so in development of that tip sheet, we interviewed young people, and some of the quotes that I'm about to share were the results of those interviews. And we kind of organized them in a tips format to make it easy for you to understand what young people thought was most important for professionals to know when working with older youth and preparing them for permanency. So the first one you'll see is help youth understand what family, belonging, and permanency mean. So as we know, some young people who have grown up without the security of a consistent family, or maybe has lacked in strong, positive peer relationships, they don't always recognize the necessity of the relationships. Or it might be, even though it's the one thing that they need, it's also the one thing that is the scariest to them. So it's important for professionals to continue to kind of process that with them and stress to them the importance of connections, especially as they are preparing to enter adulthood. The young people that we interviewed commented on the sense of hope that accompanies permanency and kind of this sense of despair that can come from a lack of connection. And so you'll see that in this quote on your screen. Help youth understand you cannot grow up in this world alone, and that you actually do better with people around you and supporting you, people in your life that are going to help you get there and achieve your goals. So try to help young people kind of look long term. So they might be thinking in more immediate terms that they're eager to get out of foster care, right? And they're eager to, like any teenager, to be independent and out on their own. So I think Joe's quote just kind of reflects the importance of helping them kind of see past that. And it is completely normal that they want to be independent, but that they need to kind of have a positive support system in their corner. Next slide, please, Alicia. So the next tip is to help youth explore their permanency options and identify what it is they want for their life and why. So help them do some goal setting and kind of, again, that long-term planning. And help them explore the different permanency options that they have, adoption and guardianship, as well as relational permanency and the importance of having positive supports. And similar to what Dawn was talking about through the lessons learned through NTI, it's important that young people can process kind of what has happened to them, specifically about the separation and loss that they have experienced, and be able to talk through that so that they can move towards a path of healing. And an important piece that came out through our conversations with young people is to continue having the conversations. So they might be resistant in the beginning, but it's important that these are ongoing conversations that you have to educate them about their options, but to also listen. It's really important to listen to what their questions might be and any concerns that they might have, as well as providing young people the opportunities to discuss permanency with their peers. So you can also see the quote on your screen that, and let's see, I gotta just get the control panel away. So that this young person didn't really initially want to be adopted because they were scared. And we see that all too often with older youth who have been in care. It's if they've been let down or have had some relationships that maybe didn't work out the way that they wanted to, it's hard for them to be willing to go into that type of situation again. The next tip is to not allow independent living to be glamorized. So this goes back to the piece of, we know that it is developmentally appropriate for young people to be wanting to be independent, to start to kind of move away from parental figures and be thinking about the life that they want for themselves as an adult. But it is our job as professionals to help them kind of think through what will be needed, specifically the support that will be needed for them to achieve the goals that they have for themselves. And so you can see in this quote, and I think this is profound, now that I'm 21 and I've aged out, I know that aging out is probably the hardest part of foster care because you are truly alone with no help from anybody. No one checks up on you and everybody expects you to do the right thing and be a productive member in society despite not having the right tools to do so. Next slide, please. So 2 more quotes that we gathered from our interviews with young people. The first one being recognizing that family loyalties might be impacting a youth's desire to pursue permanency. It might make them resistant or hesitant to pursue adoption or guardianship for fear of hurting their parents or their family. And it's important to help them know that they aren't losing their family, they're adding to it. And if possible, it's even more helpful if professionals can ensure that birth family members, birth parents, siblings are involved in the permanency planning process. And this can help youth in kind of navigating their questions and their feelings and being able to have conversations with their family involved so that they can feel more comfortable with moving forward with permanency. And you can see that reflected in Teresa's quote. The last tip is that everyone's story is unique. Know the youth that you work with, listen, and advocate for them. It was pervasive throughout all of our conversations with the young people, the concept of a desire to have an authentic relationship with their case manager and any other professionals that were involved in making decisions regarding their life. Young people want to feel like they are important to the professionals and that the professionals know them as a unique individual and care about their opinions and their thoughts and the goals that they have for their life. And as well as understanding what relationships and family means to them and helping them to achieve that sense of family and connectedness. So, these insights for the young adults are just kind of an introduction to, we are lucky to have a panel with 2 young adults with us today. And so I'm going to hand it back to Alicia to begin our panel with Aria and Joshua.
Great. Thanks so much, Erin. And thanks for sharing those insights. And I think it leads in so nicely for this discussion, especially the points about the importance of really listening to young people, listening to the individuals, recognizing they are each unique and they have their own insights. That really, as you know, Erin, that's a key part of why we're so excited to have this panel discussion for this webinar. With this year's National Adoption Month theme being focused on youth voices, we wanted to be able to say to the youth and young adults that we work with, what is it that we should hear and what is it the field should hear from you, so that we're really hearing those voices directly. So we're very excited to get into this part of the presentation. I have the privilege of getting to briefly introduce Aria Williams and Josh Christian, and I'll let each of them introduce themselves in more detail. So Aria, do you want to start off and just tell us a little bit about yourself?
Yeah, I can do that. So great. I was in foster care for 8 years, and I was adopted when I was 16. And I'm now 20, and I'm going to school right now. I'm going to college. And I also have 3 siblings as well that went through the system with me. Kind of a brief overview of me, I guess.
Great. Thank you. Josh, would you like to introduce yourself?
Absolutely. Hey, everyone. My name is Josh Christian. I'm 22, and I'm a foster care advocate, and I spent about almost 2 decades in the child welfare system. And around the age of 16 or so, I ended up meeting part of my forever family. And today, I am excited to be here with you guys and explore the unique needs of young people and child welfare.
Great. Thank you, Josh. And I just want to thank you both again for being willing to share your insights and perspectives and wisdom with all of us today. It's always so valuable for all of us to hear directly from you and hear the different perspectives you have and tips that you would share with the field so that we can all keep getting better at doing our work and really engaging youth in appropriate and in great ways. So really helping us all achieve our desired outcomes for children and youth. So for our panel discussion, I want our audience to know we'll be covering several topics. We may not go through everything in a fully linear way, but really want this to be a discussion. So we'll be hearing from Aria and Josh, and then we will have time at the end of this section to address questions from the audience. So if you have questions that you'd like us to get to, feel free to submit those questions in the question pod on your screen. So, Josh, let's start with you. What did your caseworker do well to help you explore permanency and adoption? What were some effective approaches that you had in your experience?
My case manager, one of my case managers when I was around the age of 16 or so, I had been in care for so long, and he really just kind of took a dive in my file and started asking me about things and trying to get clarification and just kind of understand me and give me the respect I deserved as a young person. And he met me where I was at, and I didn't feel like pressured, and he talked to me about different things. And I had another case manager as well that had experienced care himself, and he had a really unique perspective and just kind of as well met me where I was at. And whenever they did those things and kind of made long-term conversations with me around my goals and things like that, by the time I ended up aging now. I met a lot of my goals in college and other particular activities that young people might want to get involved in.
Great. Are there things that you would have liked your case manager or case managers to have done differently in working with you and helping you explore adoption and permanency?
Yeah, well, I think so. It just kind of depended on me. Whenever they were meeting me where I was at, a few case managers that had this conversation with me, especially early on, would only have it like one or so times. And as a young child at that point in my life, I really didn't understand what that conversation even meant. I didn't even really know what fears I had about the idea of adoption. And I think if something that could have been done better is just kind of making that more of a long-term goal, and would have helped me understand what it is, and the fears that would have come up over time could have been addressed, and then maybe I would have been a little less, maybe I would have felt a little less anxiety when I thought about the idea of adoption.
Thank you. Aria, how about you? Are there things that you would have liked your caseworker or case manager to have done differently to support you in exploring adoption and preparing for permanency options?
Yeah, I think so. I had several caseworkers in my life, and something that I think that they could have done a lot better was just making sure that I was aware of what was going on in my own life. I didn't really have that a lot with my workers. It was a lot of kind of going through the motions, as they probably did with a lot of their cases, but obviously everyone's different, so it would have been nice to have some individualized help or a relationship with my caseworkers. I think that something that would help a lot with, I think, a lot of kids, and I think it's been mentioned already in this webinar, but it's just letting the kids know about their past homes, like why did they leave their homes, making sure that they're aware of what's going on in their own lives, so that they can move on, so that they can understand what a healthy relationship is.
Okay, Erin, we're having a hard time bringing Alicia back. Can you step in for her here?
I sure can. Hold. I was just going to pull up the questions real quickly. Sorry about the delay. Okay, I'm just catching up here. So another question, and I'll go back to Josh for this. Knowing what you know now, what advice would you give youth who are exploring being adopted or approaching the possibility of aging out?
If knowing what I know now, I think the advice that I might give the youth in exploring adoption is one, realizing that anything we do when exploring topics typically is always going to be challenging, and I would encourage having this a conversation, a long-term conversation, and just kind of staying open-minded and knowing that maybe excuse me, knowing that adoption may or may not be for you, and that's okay, and just kind of educating themselves on it, and as the different things that arise up through these conversations, take a leap and to address those different focus areas.
Great. Same question to you, Aria. What advice would you give youth who are exploring permanency?
Yeah, I would say one of the biggest things that I think holds kids back is having concerns and maybe not feeling like they're valid enough to express. So I would encourage them to express any concerns that they would have with their caseworker, so that the caseworker can address them and help them understand that their concerns are valid, but that they are able to work through them. And I would also encourage them to not stress about the adoption part so much, but to focus on developing a healthy, trusting relationship, but that adoption is always a good option as well. But it's important that the caseworkers understand, the foster parents understand, and the kids understand that you definitely need to have that healthy, trusting relationship before anything can go, much further, which is easy to do, once you express those concerns. I think it kind of goes hand in hand there.
I agree. And I think building off of that, and this question can be for one or both of you, what would you say to professionals is a tips for how they can talk about or promote permanency? And kind of like you both mentioned, youth should be able to express their concerns. So how do professionals best respond to those concerns and continue to encourage adoption and guardianship and this idea of permanency? Josh, do you want to start?
Sure, absolutely. I would really, the advice I would provide to professionals in terms of exploring adoption would be very similar to youth, as just recognizing that education is really powerful, and just like anything else, if we attend a class or something like that, unless we attend it many times, we're not likely to remember the information or explore different thought areas. And when speaking to youth, young people want to feel important and feel like they have purpose, and when a professional takes the time to get to know them for who they are, they can really start to build that relationship or that connection that we were just talking about, to kind of further their goals and their case plan, and just really see through the lens of young people and see what is in the best interest of that child.
Aria, would you like to respond to that question as well?
Yeah, I would love to. So something that I struggled with when I was kind of in the process of getting adopted was getting adopted with a family without my siblings. And that wasn't something that I'd ever really entertained before then. But something that kind of helped me get through that was to just making sure that the communication pathways are open between the siblings so that they can stay connected, and addressing that. And I think that it's important that caseworkers address adoption. I know sometimes caseworkers can, be on the fence, like, do I push it? Do I just let them decide? And I think it's important to bring it up and help the kid understand that it is an important step to having a permanent family. But that, again, like I've said before, emphasizing that healthy, trusting relationship is very important. I know sometimes if you're pushing the kid to get adopted too hard, then they can, start pushing back, and they'll start to feel like maybe it's not their choice. But a good way to go about that is to just make sure that everyone has an open relationship, open communication about it, and that way when the kid does, feel like they want to be adopted, because they have that good relationship, they'll feel like it's more of their choice.
Great. Thank you both. Josh, how about, do you have any tips? So we've talked about professionals. How about any tips or words of advice for foster parents, foster or maybe prospective adoptive parents or prospective guardians on how they can approach talking about permanency and engaging young people?
Yeah, absolutely. Throughout the past 4 years of my advocacy, I've had many chances to speak with foster parents, and I find this common trend where they are expressing to me fears of maybe taking in a young person. Sometimes it's financially, and when we get over that barrier, then if we're talking about taking in a teen by any chance, I hear things like fears around going through puberty stages, going through maybe like curse words, or just really things that you kind of see throughout the normal development of a young person as they continue to age into adulthood, regardless if they're in child welfare or not. And I would just remind them that, I personally had experienced around 18 different placements, and I found my forever home a week before I turned 18. But my fear, as a young person aging out, I was so scared of not having a family, of not having a place to call home, or maybe going to the holidays with, and I wanted to feel loved. I wanted to feel important. And when you start to think about the fears of the young person, that may, the fears of the foster parent around the stages of a young teenager may quickly go away when they realize some of the realities the young person may face.
Great, thank you very much. Before we get into some questions from our audience, I just wanted to give both of you an opportunity, if you had any other insights or tips, things that you wanted our audience to know about how best to engage and empower youth voices that maybe we haven't covered through the questions thus far.
I think I have something here. One of the things that I see across many states is young people, and including myself, right? I'm 22, and in May, I will be adopted. However, I found my forever family a week before I was 18, and I could have gotten adopted a lot earlier on. But sometimes young people are faced with a decision that I believe that they should not have to make, and that is the decision of a young person deciding whether or not they want to legally be adopted, or even if they have that forever family, I chose, regardless of financial means, if they're there or not, that I did not want to place any financial burden or anything like that on my family, because I love and respect them so much for everything they've done for me. And the benefits of aging out of care and transitioning to adulthood, designed to help young people become young adults. And regardless, I think if they're adopted or not adopted, they were in care for a period of time, and they still may need the extra assistance. I think that's a really tough decision that young people make all the time, and I don't think that's one that should have to be made. I think states should explore the ideas, or professionals should explore the ideas of pushing policy around that maybe having some type of level or something that just says that even whatever you get when you transition out without a home, or whether you're adopted, or almost the same. And I think that is one of the things I wanted to mention. And the other thing I would want to mention is, forgiveness, right? That is a really important topic. And sometimes to explore that topic, one has to be vulnerable, and that's anything but a weakness. And, throughout my life and the different hand I was dealt through these different placements, it took a lot out of me. But I knew I needed to heal, and I knew I needed to, with my family, who I love deeply, needed to make amends with my bio family at some point. So we explored the option and together, which was really hard, because I was really scared of what they may think, because I didn't want them to think at all that they were not my mom and dad, because they definitely are. And they were so loving and so supportive about it. And I would encourage people to kind of just think about how, despite one's feelings based on the bio family and why the child is in care, that connection right there, or that forgiveness, or whatever it may be, would be the best interest in the child, and taking the most positive approach one can do.
Thank you, Josh. Those are both excellent points, and it's important for us to keep those things in mind. Aria, did you have anything additional that you would like to share before we go to the questions?
Yeah, just something really quick. I was just thinking about how hard it is sometimes for foster youth to kind of understand what a healthy, dependable relationship is, because sometimes, they go through their whole life kind of feeling maybe a little bit disposable, or kind of holding on to people that aren't necessarily healthy examples of a good relationship. And something I would encourage caseworkers to do is to just make sure, caseworkers can't always guarantee the kids to always have, a dependable, healthy family, because, like Joshua and I have both been through several foster homes, as he said. So I'm sure we could both attest that something that is a constant, though, is the caseworker. So something that would really help the youth is for that caseworker to be that positive example, rather than waiting for the family to kind of pull through and be that good, supportive relationship, which hopefully it is. But I would encourage the caseworkers to also try and be that positive example as well.
That's a great point. We learn how to be in healthy relationships by having a healthy relationship. So I love that. Thank you. Okay, so I think that we have Alicia back, and she's going to pose some questions from our audience.
Yes, thank you, Erin, and I apologize for the technical difficulties. Thank you for jumping in on that.
No problem.
I am back, and we've gotten some questions coming in from our webinar participants. And for those of you on the webinar, you can continue to submit questions for Josh and Aria if you'd like to, and we'll get through at least some of those. And for some of these, I'm going to merge a few questions into one. Josh and Aria, we had a few questions really looking at the topic of connections with your biological family and with your relatives. So I'm wondering if either of you would want to share anything, and you don't need to feel a need to, but is there anything you would share either from your about your experience or just based on your experience about approaches for helping young people understand information about their birth family or maintain those connections, especially as professionals are supporting youth in exploring adoption? Anything you think we should keep in mind about that kind of information about birth parents or about siblings? Any tips you'd want to add on to what you've already shared?
Sure. I got a few quick tips. One of them is, my biological family was not a healthy environment for me at all. However, when I first entered care around the age of 2 or so, and I spent all my, despite the unhealthy environment, the image or the hope I had in my head, I spent almost all my birthdays until age 13 wishing to go back to that unhealthy place. And so if there was some way that regardless of me, if there was somehow I could have been supported in that transition of or just somebody sitting down and having honest conversations with me. And I was a young little man, so I would have hoped if this was done, maybe it could have been a longer conversation and slowly, progressively going. And one other thing in terms of connecting with my bio family, and I'm the baby out of 6, and I was the only one ever adopted. And I had a brother that grew up for me for a long time. And to professionals, I would highly suggest that when they have caseloads, one, I would suggest for case states to make caseloads a reasonable size, and then 2, professionals to even when kids have a good face, and not so troubling case, that they really focus on those children too. And because my brother was a really, really good face. I was the one who was always presumed to be in trouble, and and he ended up passing away to his own doing. And I truly think that's because his mental health wasn't addressed and not focused on through those cases.
Thank you for sharing that. It's really, I'm sorry to hear about your brother, and it's really helpful to hear your insights on that, and for all of us to think about how can we support all of the young people in care in those various stages, and not make assumptions about what level of support and encouragement and assistance they might need at all of the stages that we're working with them. So thank you. Aria, is there anything you'd like to add to that, or should we move on to the next question?
I didn't really have much of a relationship with my bio parents, so I don't know if I'd have a lot to add.
Sure, that's fine. So I want to let you both know, Josh and Aria, we've had several comments come in through our questions pod, just really thanking both of you for being so transparent and open and honest with us and sharing your insights. That's a big theme coming in a lot of the comments. So I wanted you to know that those are coming through. We do have more questions, but people are really appreciating hearing from you And someone said you both sound like amazing young adults. I agree wholeheartedly. So with that, we'll move on to some other questions. One is, what are some ways that you would have liked to discuss permanency with your peers? So I think, looking at this of what would be helpful, what would have been helpful to hear, or what opportunities might have been helpful to hear from others your age, or maybe who'd already been adopted or aged out, to help you think about your options. Do you have thoughts on what would have been helpful, or if that happened, what worked well for you in hearing from your peers?
I think something that I don't really hear from any peers that I really knew that were adopted, but I do know that my brother, and this is different obviously, but my brother was adopted, both of them, a year after I was, and I know that was really hard on them. But I think seeing me go through it and me having a positive attitude about it and me making sure that I still kept a relationship with them was really helpful in their decision making.
Great, thank you.
And I just got a really quick comment here, not really long. And I travel a ton and with a lot of different advocacy groups, and when I meet young people around my age, all over the place, and they've had a chance to be adopted or find a forever family, I find that so cool, and the excitement that kind of comes out of them when they just talk about their family is awesome. And and then when I see my other peers when I travel that haven't found that, it's really sad, and it makes me think about those kids that aged out that may have had an opportunity to be adopted, and it just kind of motivates me to continuously want to give back, I guess.
Thank you. I will add to what you both said, just some things I know we've heard from other youth in foster care, and then some young adults who've been in care. I've heard from several people express the value of being able to hear from peers or other young adults who may have gone through the system already, to be able to hear from them about the importance of having those healthy, permanent relationships, and the importance of being adopted, as Erin mentioned earlier in some of our interviews with young people, helping youth not glamorize the idea of independent living, that often some of the best messengers for that can be youth and young adults who have that lived experience, and that can resonate a lot more than hearing things just coming from caseworkers or from foster parents, but to really be able to hear from those people who've walked in those shoes specifically and can share their insights, which is in part why we're having you both on this webinar now, is so that we can hear what are your thoughts and insights based on your experience, so that we can all take this back and apply it to our work. Another question that came in, Josh and Aria, is about your perceptions in working with CASA, so a court-appointed special advocate. I'll expand that. You may have had a guardian ad litem, or you may not have had anyone in that role. But if you did have someone in that role, or you have thoughts about it, what advice would you have for CASAs or GALs in working with youth? What would you want them to do or learn about to work effectively with youth in foster care? Do you have any thoughts on that?
I never had a CASA or that other thing that you said.
Okay, all right.
Sorry,
all right.
So I can't really.
No,
say
that's
much.
fine. No, that's helpful to know as well.
I did have a guardian ad litem at some point, and I saw them every so often, and my advice would be to them would be to just kind of, in my case, the communication wasn't really there, and I really didn't know who they were, and they just seemed like another worker that was coming in and out for a while. And I would just advise folks in those roles to really think about how they can impact those cases, especially when having a legal representative at the table and ensuring that they get whatever they need and ensuring that their permanency plan is being addressed properly. And that may even be an opportunity to talk about in those court cases the long-term goals we keep mentioning, and it may be an opportunity to fulfill that a little bit more.
Great, thank you. Do either of you have thoughts or recommendations on ways that would have been helpful for your workers to involve you in the process of recruiting families or trying to do family finding on your behalf? So I can phrase that a little more clearly, but are there things that would have been helpful for you to really have your voice heard, or things that other workers could do to make sure that youth have their voice heard in that recruitment process as they're looking for adoptive families for children in foster care?
I would say making sure that they're involved in, every aspect that they can be, making sure that all of their wants and needs are met, and understanding that it might take some more time, I guess, than it would just to do it on their own, the caseworker on their own. Maybe take the kids out, maybe outside of the office, wherever you meet, and just really talk to them and ask them away from anyone else what they want in a family. I think would really help.
Great.
I think she summed it up pretty great.
Sorry, what was that, Josh?
I said I think she did a great job at answering that. I don't have anything else to say.
Okay, great. And yeah, Aria, I think your point is such a good one, that especially in thinking about what's the setting where we're having these conversations with young people, and are we able to show that it's important and that we're taking the time for it, and not force that into a brief conversation or other interactions, but to really make it that conversation and be part of the relationship building. I think that's a great thing for us to keep in mind. One other question that I think you may have touched on a little bit in some of your earlier comments, but are there ways that you were each involved with your caseworker or your case manager in any of the recruitment or family finding in your cases? And again, you don't need to go into details on that if you don't want to, but any things any ways that you were involved, or ways that you think additional ways that would have been helpful to involve you?
Sorry, go ahead.
No, you go ahead.
I would say that I had an interesting adoption case story where I was living with a family and then I got adopted by them. So it was a little bit different, I guess, than that. But in my past experiences, because I did have 3 previous failed adoptions, but in those experiences, I did feel involved in the sense that I was given I was given options of what I wanted in a family. And obviously I had my 3 siblings with me too, so they gave their input as well. But I felt after that experience, I don't really remember much of having a say in it, other than, hey, here's the family, you're going to move in now, sort of an experience. So I guess it would have been nice to have gone through the whole thing, saying, okay, maybe these are the families that we're looking at, what do you think? But I'm not super sure how the process goes because I wasn't really involved. Mm-hmm. So I don't know if I can say much about it. Maybe that speaks for itself. I'm not sure.
Yep, I do think that shares a lot of insight in of itself, that you weren't shown and weren't involved in that to be able to see how the process works. Thank you. Josh, did you have something you wanted to add?
Sure. I don't know really how much I was involved either. Especially as I just went from home to home to home, I felt like in the process of moving into a family was just kind of like super random, and I don't even know if I almost wonder if they had maybe would have considered it would have been helpful to consider maybe that certain homes would not have been too good for me, or they're just, I felt like I was just kind of lingering around and just being placed wherever, and trying, I felt like it was just trying to be, they were trying to place me like ASAP. And even if that meant that the placement was not the best in my interest and as the child, and my advice would be to caution completely away from that, and of course place the child as soon as they can, but definitely in the best interest of the child.
Great. Thank you both. So thank you all for submitting questions. I know we couldn't get to all of the questions you submitted, but I hope this was a really helpful discussion based on the comments coming in. It sounds like you all agree with me that it was really helpful. Josh and Aria, thank you both again so much for your openness and your willingness to share your insights and information about your experiences and helping us all think about what we can do better and how we can show up differently to really engage youth and hear their voices and really make them part of the process so that we're involving them from the beginning. This was really very, very helpful. We're going to move to the next part of our webinar now and highlight some resources. I know based on the questions and comments coming in, we could spend another hour or so, probably multiple hours, getting insights from both of you. But we'll leave it there for now, and hopefully be hearing more from both of your voices in the future to help us all keep thinking about this work. So now I'm going to turn this back over to Erin from Child Welfare Information Gateway to have her highlight some of the great resources that we have available to support you for National Adoption Month. Erin?
Great, thank you. So as I had briefly mentioned earlier, one of the key resources and one of the primary activities in addition to this webinar each year for National Adoption Month is the creation of and the launching of the National Adoption Month website. You can see the link there. This website is funded through the Children's Bureau and is developed in partnership between Child Welfare Information Gateway and AdoptUSKids. So I'm going to walk you through the website just via some screenshots, but please do take some time when you have free time or a free few minutes to visit that website and kind of peruse it yourself. But I am going to point out some of the key features and key highlights. Alicia, can you go back real quick to the home page? I was just going to point out a few things. Thank you. So at the top, you can see, again, our theme and our focus, Youth Voices, Why Family Matters. So the resources on the website are going to be related to engaging young people in their own permanency planning, as well as resources about the importance of connectedness and a sense of belonging. So you'll kind of see that theme woven throughout all of the resources on the page. Also underneath that main photo is the Meet Older Youth. I wanted to point this out specifically. It is a link that will take you to the AdoptUSKids photo listing featuring teens who are currently available for adoption and in need of permanency. And then you can see the highlights reel. That's kind of just our what's new. So when the Adoption Excellence Award winners are announced, those will be featured there, as well as the Adoption PSA ad campaign. Once that has gone live, we will link to it in that highlights section. So it's kind of what helps keep you up to date with what's going on with National Adoption Month. And the 6 boxes below highlight some of the key pages, and I'm going to quickly walk you through. But that 6 box I wanted to point out is the links to the Child Welfare Information Gateway's How to Adopt section. Based on some survey feedback that we received a year or two ago, there was some visitors to the National Adoption Month website that were looking for information on how they themselves could become licensed to adopt. So that is why that is featured there. Okay, next slide. Thank you. So our resource pages are organized by resources for professionals and then resources for youth. So as you'll see, the landing page for resources for professionals, we have 3 separate sections. The first one is for child welfare professionals, and then the second is a new page created this year specifically for legal professionals. As we all know, garden ad litems, CASAs, judges, parents, attorneys, all of the legal world plays such an important role in helping children and youth reach permanency that we wanted to feature resources to help them also engage young people and to talk to young people about the importance of family and permanency. And then the third one is the grantee resources page. So this page features resources from all of the Children's Bureau adoption grantees, with the national training initiative that Dawn presented about earlier is included in that, along with other great grantees who are doing really impactful work. Next slide, please. So this just takes you into each of the specific pages I talked about. So this is the page for child welfare professionals. You'll see links to various resources, and then there's the tip box, kind of a quick read. So these tip boxes are just to draw your eye to some quick things. If you only have a minute or two to see what resources are available, that tip box is a great first step. Next slide. And this is the legal professionals page. Again, we link to a variety of resources. So we are linking to resources created by other state and national organizations. Next slide, please. And this is the grantee resources. So if you click on, those are the names of each of the grantees. And if you click on each one, it's kind of a drop down, and it will give you more information, contact information, as well as link to resources that have been created by those grantees. Next slide, please. And this is the resources for youth page. So this is written specifically for young people to provide them information about permanency, helping them to kind of explore what their options are, as well as stressing and the importance of, and kind of sharing the importance of relationships and family, especially as they are moving towards adulthood. And again, you'll see a tip box off to the right that kind of just gives them some quick steps of things that they could do to become involved in their own case. Okay, so the last resource on the Gateway side that I wanted to highlight was the tip sheet. So I did go over some of the quotes in the beginning. Again, this tip sheet was developed in partnership with AdoptUSKids, as well as the North American Council for Adoptable Children, and you can find it at that link. I wanted to say that it was a youth-driven product. So even right down to when we first started drafting the questions for the interviews, those were created in collaboration with all of the organizations and the Children's Bureau, but also we had input and they were reviewed by young people. And then we interviewed young people, as I had said earlier, who had lived experience in the foster care system, who had reached permanency through adoption, or had left care, had aged out without permanency. And then again, when the publication was ready, we allowed the young people to kind of review and provide input again, and valuable feedback. So I say all of that just to demonstrate that we really wanted to kind of walk the walk. With our theme and our focus being about youth engagement, we felt that it was important to create this resource that was driven by the young people and the young adults, so that they could have their voice heard and that it could then be shared with all of you. The intent of this tip sheet is to help professionals, but also for professionals to use it as a tool, maybe to start the conversation with young people if you are wanting to talk to them about permanency and their options, and helping them kind of consider what they want for their life. That is all for our Gateway resources. And so I'm going to hand it back to Alicia to share about some resources from AdoptUSKids and the Capacity Building Center.
Great. Thanks so much, Erin. So to add to the great resources that Erin just highlighted, I wanted to let you know about just a sampling of some of the great supports also available from AdoptUSKids. Hopefully many of you are familiar with these resources as well. One of the great tools that's available through AdoptUSKids is our national photo listing, and it features more than 5,000 children and approximately 2,500 families who are home studied and approved to adopt. So it's a great way to search for families, especially as you're looking for families for older youth. You can find many families on the photo listing who are specifically interested in adopting older youth, and you can search by that. So it's a great way for you to look for families and explore those options. There are specific family finding tools within the photo listing. So for professionals who are registered with our photo listing, you can search for approved families, as I mentioned, who are specifically interested in adopting older youth. And there are ways to do that search even on behalf of children or youth who are not registered or not photo listed with AdoptUSKids. So if that's a barrier, or if the child is not yet photo listed with AdoptUSKids, you can still look for families who would be a match based on the child's age and characteristics. And it's a good way to explore those options. AdoptUSKids also has a recently launched hub for professionals, which is a great way to find the resources, publications, webinars, articles from AdoptUSKids aimed at child welfare professionals. Many of these resources are really focused on helping you figure out how to recruit adoptive and foster families, but also how to respond to those families and prepare them and provide the crucial ongoing support that we know families need. The Hub for Professionals can also highlight some of the other available services from AdoptUSKids, since there are many components to the project and a wide range of ways that the project can support states, tribes, and territories in your work in recruiting and developing and supporting families. And then we also wanted to highlight some great resources that are available from the Capacity Building Center for States. That center developed a series of tip sheets on partnerships for permanency, and this was really focused on ways to engage various key community partners in efforts to achieve adoption and guardianship for children and youth in foster care. These resources were developed really focusing on the Children's Bureau's adoption call to action and wanting to support states in their work on that. So the link on the screen here shows where these 3 tip sheets are. One is focused on partnerships with faith-based communities. Another focuses on partnerships with non-governmental organizations and nonprofits. And then the third focuses on ways to engage philanthropic partners in this work. And as we're highlighting these links on the screen, we will be sending out this PowerPoint presentation to all of you in a follow-up email after this webinar. So you'll be able to get the full presentation, including these links, but you can also search on the Capacity Building Center for States website to find these resources if you'd like to get to them right away. So we are nearing the end of our time together. We have just a few minutes left. I'm looking to see if we have any additional questions that came in. I'm seeing some appreciation for the new page on the National Adoption Month website for the legal professionals page. So Erin, kudos to you especially for bringing that into the focus for this year and making sure we're highlighting that. Looks like we will need to wrap up then at this point. We won't get to any other questions, but I thank all of you for submitting those questions. Hopefully we were able to address them as we went in a helpful way. We do have one final poll question, as I think I mentioned at the beginning of the webinar. This is where we want to hear from you about what else would be helpful to support you in doing this work of engaging and empowering youth voices in your work and as you work towards achieving permanency. So I will launch this poll, and then we will wrap up here. Let's see here. Pull this up very quickly. So we'd like to have you respond to this poll about which of these resources and information would be helpful for you. You can click on these, you can select all that apply. If you have specific suggestions for what things would be helpful, what information and resources would help you empower youth voices in your work, you can submit that. You can type out your thoughts or your notes in the questions pod, and that will get to us. We don't have an open text box available in this poll, but you can send your thoughts to us now, and as always, you can feel free to follow up with us and let us know your feedback. We really welcome that, and it helps inform our work going forward. So I'll leave this open for just a few more seconds to let people respond, and then you all can see what your peers are saying in their responses. And then again, if you have additional thoughts on this, feel free to submit that in the questions pod, or feel free to be in touch with us after the webinar. Let's show what you're saying. Very popular is the idea of getting more tips from youth on effective engagement strategies. I think we're all continuing to see how valuable it is to hear directly from youth on what worked well for them, what they would like us to have done differently, and ways we can move forward in doing this work even better in the future. So thank you all for providing these responses. We will certainly think about this for ways that we can support your work going forward. With that, I just want to thank everyone again for joining us for today's webinar. I want to really thank all of our presenters for being part of this event. Josh and Aria in particular, thank you again for all of the time that you spent with us today and leading up to today, and for sharing your thoughts and insights and wisdom. It really does help shape all of our work. As a reminder, you'll get an email following this webinar with a link to an evaluation survey. Please do fill that out so we can keep learning from our efforts and improving on them and planning ahead for future events. Thank you all, and have a wonderful rest of your day.